Hello, I'm Arsha Vahabzada reporting from CES 2018 at the Digital Health Live studio, and I am joined by Dr. David Rhew. He is a Chief Medical Officer and the Head of Healthcare Fitness at Samsung Electronics America. Delighted to have you here.
Thank you, it's a pleasure, thank you.
Now, let me ask you, what is Samsung doing in the healthcare space?
Well, I think most of you know Samsung for our mobile products, our phones, our wearables, TVs, home appliances. And I think what most people don't realize is that Samsung has a very deep and long-standing commitment to healthcare. So a really good example is in 1994, Samsung established the Samsung Medical Center. It's a large tertiary care facility based in Korea, South Korea, and it's providing some of the best, latest technologies, and actually say best care for patients. And what we've realized is that, when providing care and using technology, we can actually make things more efficient. So one of our goals here within Samsung Electronics America and Samsung Healthcare is to see how can we take some technologies that people use every day and allow us to be able to expand outside of the hospital, be able to engage patients, consumers, be able to capture data, and be able to have better connections with your healthcare provider.
That's fantastic. In terms of looking at the kind of healthcare opportunities, what are the things that excite you the most personally?
Well, I can tell you there's a few things that I get really excited about, and all of them are things that I would not have envisioned years ago. First is around just the way that we manage care. Today, much of the care is based episodic. It's based on the fact that you go into the hospital. We're starting to see virtual care models being developed, and we're talking more than just simply a telemedicine visit. We're talking about, imagine cardiac rehabilitation is a great example. A person's had a heart attack. They are asked to go for 6 to 10 weeks. Where they come into a facility 3 times a week, maybe 30 minutes, 45 minutes, and it's really important that they do this. Unfortunately, most people don't complete these programs. And the reason is because we've made it difficult for them, because we're having them to adopt and adapt to our schedule, our facility. And because of that, adoption rates across the country are pretty low. I mean, we're talking about 30, 40%. What we realized is that that entire program could be digitized and put on your smartwatch. In fact, it was put on the Gear S2, and what we did was we then applied that, and we saw that the completion rate for these programs went from 40% to approximately 80%. So we nearly doubled that. And when we asked the cardiologists and the clinicians, what did that really mean? They said, for every 4 patients that were completing this program, you're saving 1 life, which was phenomenal.
It's powerful.
Powerful. We even went to the American Heart Association. We said, this is the type of opportunity, and they said, absolutely. We need to really be looking at virtual care models for some of these things that we're doing today.
Wow. Thank you so much for those. Thank you so much for those insights. Much appreciated, and great work on your panel today.
Thank you.
Thank you, Dr. Rhew. This is Arsha Vahabzada reporting from CES 2018 at the Digital Health Live studio, presented by United Healthcare. Thank you.